Social media today actually creates many myths. Myths about women's risk of heart disease and stroke are those that we're going to analyze today and sort the reality from the truth. Our first reality is women are, whether you consider it a blessing or a curse, provided with a far more complicated physiology surrounding their reproductive capabilities, and this has far-reaching impact upon the quality of their life, health, cancer risk, and cardiovascular health. So let's take a look at some of the leading health concerns for women. Heart disease, that's the number one killer of women. Cancer is the second leading cause of death, and stroke the third leading cause of death. Another concern is osteoporosis, which is common to almost all older women. Dementia, which is the leading cause of nursing home placement, and menopause, a quality of life issue for about 1/3 of all women. And generally, when women are younger, they have concerns about menstrual issues, nutrition, fertility, being overweight, and exercise. So let's take a look at the perceived health threats to women versus the reality of the leading causes of death in women. Here are some of the health threats that women perceive to have: cancer, breast cancer, heart disease, and heart attack. Notice that heart disease and heart attack are very low on their perceived threats. Now let's look at the leading causes of death in women. And you'll notice that coronary arterial disease, or heart disease, is number one. You'll notice that cancer is only about half of the deaths in women when compared to coronary artery disease. A much smaller percentage of death in women is attributed to COPD, chronic obstructive pulmonary disease, pneumonia, and accident. About 2.5 million women per year in the United States are hospitalized with cardiovascular disease. And the deaths from cardiovascular disease are greater than 500,000 per year. The number of deaths resulting from coronary artery disease is equal to or greater than 230,000 women each year. Some interesting statistics are that women between 45 and 65 who have a heart attack are more likely than men of the same age to die within a year of the heart attack. However, a heart attack is less common in younger women than in younger men, and this is partly because of the hormone estrogen, which protects the heart against disease in younger women. After menopause, we find that women older than 65 are more likely than men of the same age to die within a few weeks of a heart attack. On the whole, women usually have heart attacks about 10 years later than men. The average age of a heart attack for a man is about 64 and woman about 72. Although 67% or more of women are knowledgeable that chest pain can be heart disease, less than 10% are knowledgeable that shortness of breath, nausea, and indigestion can also be heart disease. Interestingly, less than 50% of women actually have chest pain when having a heart attack or a myocardial infarction. Almost half of the myocardial infarctions in women present with shortness of breath, nausea, fatigue, and shoulder pain. Women are twice as likely as men to die within the first few weeks after suffering a heart attack. 46% of women and 22% of men, heart attack survivors, will be disabled with heart failure within 6 years. Women are 2 to 3 times as likely to die following heart bypass surgery. Younger women between the ages of 40 and 59 are up to 4 times more likely to die from bypass surgery than men the same age. Studies show women who are eligible candidates to receive life-saving clotbuster drugs are far less likely to receive them than men. Since 1984, more women than men have died each year from heart disease, and the gap between men and women's survival continues to widen. Women also receive fewer heart disease procedures than men. However, more is not necessarily better in this setting. It was found in a National Institute of Health study that women's hearts respond better than men's to healthy lifestyle changes. Women have fewer heart attacks than men, but they tend to fare worse during them. Here we see an elderly gentleman tending his wife's grave, but usually women outlive men. The myocardial infarction or heart attack experience is different for men than women. Men experience chest pain or discomfort, shortness of breath, and nausea, and 24% die within a year of a heart attack. Women feel back, neck, or jaw pain or a burning sensation in the chest similar to heartburn, chest discomfort, dizziness, vomiting, fatigue, shortness of breath, and sweating. So let's look at some common myths versus reality. In a recent survey, 75% of women identified cancer as the leading cause of death in women. Only 13% of women believe heart disease and stroke are the greatest health threat to women. A heart attack is not the same as a cardiac arrest. In a heart attack, the heart keeps beating. The person has a pulse and usually stays conscious or awake. During cardiac arrest, the heart stops beating. The person has no pulse and is unconscious. Facts from the American Heart Association. Heart disease is the #1 killer of women, no matter race or ethnicity, and they have more deaths from heart disease than breast cancer and lung cancer combined. 1 in 29 women dies of breast cancer, and about 1 in 2.4 women dies of heart disease, stroke, and other cardiovascular diseases. When we look at heart disease by ethnicity or race, heart disease is the leading cause of death for people of most racial and ethnic groups in the United States. This includes African American, American Indian, Alaskan Natives, Hispanic, and white women. For women from the Pacific Islands and Asian American, American Indian, Alaska Native, and Hispanic women, heart disease is the second only to cancer. In the healthcare community outside of the cardiac care units, unequal standards of care are costing women their lives. Women are 50% more likely to be given the wrong diagnosis after a heart attack, and they're less likely to receive bystander CPR, decreasing their odds of survival. This may contribute to why women are more likely to die in the year following a heart attack than men. What is heart disease? There are many forms of heart disease. Coronary artery disease or coronary heart disease is the most common. Heart disease develops over years and progresses when the heart doesn't get enough nutrient-rich blood. It is chronic and develops over the years. Atherosclerosis, or arteries hardening as cholesterol, fat, and other substances build up in the artery walls, can cause a blockage resulting in a heart attack. Weeks before the heart attack, for 95% of women, they'll feel unusually fatigued, have sleep disturbance, shortness of breath, indigestion, and chest pain. At the actual time of a heart attack, women feel a shortness of breath, weakness, fatigue, and chest pain. Now, there are some things you can't change. They're not modifiable. Your age, your gender, and your heredity. What would be modifiable is the use of tobacco and an overweight condition. Being overweight can contribute to high blood pressure, high cholesterol, and diabetes. And this is exacerbated by physical inactivity. A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or stopped. Most heart attacks are caused by blockages in the large arteries of the heart, but in up to 15% of cases in which people experience symptoms such as chest pain and shortness of breath, there are no significant blockages. This was first described about 80 years ago and is called myocardial infarction with non-obstructive coronary arteries. Why are heart attacks more deadly in women? Well, one thing is women have smaller blood vessels with thinner walls, so their blood vessels are very fragile. As we discussed earlier, unless you work in cardiology, you may not recognize the symptoms. Emergency room staff and medical professionals often misdiagnose due to the unusual mild symptoms that women often have. During a heart attack, blood flow through one of the coronary arteries becomes mostly or completely blocked, usually by a clot. If a blockage continues, heart muscle dies, reducing the heart's ability to pump blood through the body. If blockage continues, the heart muscle dies. Remember, the heart disease develops over a period of time. There is a fatty buildup or plaque, which can narrow the path of blood flow to the heart and decrease blood flow to the heart. Plaque breaks off, just like you have a scab after falling on your knee and the scab falls off, and this causes a blood clot. Blood flow to the heart is blocked by the clot, and the heart dies because of lack of oxygen and nutrients. The muscle dies. Let's take a look at blood flow through a normal artery, and then the artery becomes clogged with cholesterol or plaque. Now we'll watch the birth of a blood clot. When arteries clogged with cholesterol plaque go into spasm, the hardened plaque cracks, giving birth to a blood clot. Here we see the blood clot. Blood flow may be stopped entirely, or the clot may travel to the heart or to the brain. Angina is chest pain or discomfort that occurs when your heart doesn't get as much blood and oxygen as it needs. When we take a look at cardiovascular disease, we find that among women, diagnosis and death rates are steady, but among men, they are declining. More than 500,000 women die of cardiovascular disease every year. Do you know fact number 1? One person dies every 33 seconds of cardiovascular disease. Fact number 2. Cardiovascular disease claims more lives each year than the next 5 leading causes of death combined, which are cancer, chronic lower respiratory diseases, accidents, diabetes mellitus, influenza, and pneumonia. And the third fact shown is that almost 150,000 underage Americans die from cardiac vascular disease each year. This chart shows Black African Americans, white Americans, Hispanic Americans, and Asian Americans in a comparison. We're comparing these different groups and what is the incidence of CHD or cardiac disease, stroke, lung cancer, and breast cancer. Black women are more at risk for heart disease than any major ethnic group in the United States. They have a higher incidence of diabetes and hypertension. Black women are underrepresented in a majority of the research trials and are up to 60% less likely to receive aggressive diagnostic testing. Race and ethnicity together affect cardiac vascular disease risk. The death rate for African American women with cardiovascular disease is almost 42% higher than that of white women. We can see that genetics does affect different families. On average, the total life expectancy in blacks is 6 years shorter than in whites, and the years of health life is about 10 years shorter as well. Black Americans experience a higher morbidity and mortality rate compared with other racial and ethnic groups, and have the highest age-adjusted cardiovascular disease accounts for 41.6% of deaths in black women, and heart disease rates are 67% higher for black women compared to white women. Heart disease is particularly prevalent in black women younger than 55 years of age, who have 2.5 times the risk of heart death compared to white women. Black women have 2 times the rate of angina compared with white women and 5 times the rate of angina compared to black men. Coronary heart disease is the #1 killer of women over the age of 25. Cardiovascular diseases kill 1 woman every minute in the United States, but most women don't understand the significant health threat this represents. Women get fewer interventions to help and treat heart disease. They have less cholesterol screenings, fewer lipid-lowering therapies, less use of heparin, beta blockers, and aspirin during a myocardial infarction, fewer referrals to cardiac rehab, and fewer implantable cardioverter defibrillators compared to men with the same recognized indications. Heart attack symptoms for women are more subtle than the obvious crushing chest pain associated with heart attacks. This may be because women tend to have blockages not only in their main arteries, but also in the smaller arteries that supply blood to the heart. For less than half the women who have a heart attack, they will feel some type of pain, pressure, or discomfort in the chest, but it's not always severe or even the most prominent symptom, particularly in women. 2/3 of women who suddenly die have no previously recognized symptoms. Women are prone to non-cardiac chest pain and do not demonstrate usually as you see on TV. They do not always have shortness of breath, nausea, or chest pain. Women are more likely to experience more dizziness, nausea, indigestion, and fatigue than men, and women are also likely to have neck, arm, and back and shoulder pain. They are less likely to have the classical elephant crushing your chest feeling. Many women may show up in the emergency room after much of the damage to the heart has already occurred because their symptoms are not those typically associated with a heart attack. Although the traditional risk factors for coronary artery disease, such as high cholesterol, high blood pressure, and obesity, affect both women and men, other factors may play a bigger role in the development of heart disease in women. For example, metabolic syndrome, a combination of fat around your abdomen, high blood pressure, high blood sugar, and high triglycerides. It has a greater effect on women than on men. Mental stress and depression affect a woman's heart more than men's. Smoking is a greater risk factor for heart disease in women than in men. Also, low levels of estrogen after menopause pose a significant risk factor for developing cardiovascular disease in women. 52% of non-Hispanic white women older than 20 have a borderline high or high cholesterol. Over 27% of non-Hispanic black women have high blood pressure, and less than 60% of all women know that loss of estrogen is a significant risk factor. There are many factors that you can control. The problem is that most people, just like when January 1st runs around and they want to do their loss of weight and their New Year's resolutions, don't complete them. This also goes for mitigating the risk factors which you can control over a period of time. Well, let's look back and see about the things that you cannot control, and you can complain about those when you have problems. The first would be a family history of heart disease. Can't control that. If you're over 55, can't control that. And a history of preeclampsia during pregnancy. Interestingly, these are all happening in the past, and you cannot control them. So let's get back to other risk factors that you can control, such as sleep apnea, stress or depression, too much alcohol, the use of birth control pills, particularly for women who are over the age of 35 and smoke, anemia, and an unhealthy diet. Each year, more women die from cardiovascular disease than from all cancers combined. For every woman that dies from breast cancer, there are 6 that die from heart disease. Younger women are twice as likely to die of a heart attack than younger men. Over 8 million American women live with heart disease. So now that we know the facts, let's take a look at an average woman's perception of heart disease. So now let's look at some cardiac misconceptions. Heart disease is caused by stress, worry, or overwork. No, those are not true. They contribute, but they are not the cause. Next, if you had a heart attack, you're bound to die of heart disease. Well, what happens if you get hit by a car? Then there are those that think that rest restores the heart. It does not. Rest is good for the patient, but remember, the heart is a damaged muscle. And here's a misconception I think we can attribute to the movies or television. Any excitement or shock could cause another heart attack. Not true. Interestingly enough, 72% of young women between the ages of 25 and 40 still think cancer is considered to be the greatest threat to their health. Some women know about the risks of heart disease, but do not hear it from their own doctors and do not personalize it. 65% of women recognize that symptoms may be atypical, but do not know the classical symptoms. Most women learn about coronary artery disease from magazines or the web, but not their own physicians. Today, our numbers are worse than they were in 2000. Cardiovascular disease then claimed 39.4% of all deaths, or 1 of every 2.5 deaths in the United States. In 2000, cardiovascular disease was about 60% of the total mention of mortality. This means over 2,400,000 deaths from all causes, and cardiovascular disease was listed as the primary contributing cause for about 1,415,000. So let's take a look at some statistics for women. 1 in 5 women has some form of cardiovascular disease. 38% of women who have a heart attack die within a year, and 40% of coronary events in women are fatal, and most occur without warning. Cardiovascular disease is mainly a disease of old men. This is the first myth we're going to take a look at. This is not true. Anyone can suffer a cardiovascular problem. In fact, more women are dying of cardiovascular disease than men. And although less frequent, cardiovascular disease does occur in young women. Annually, more than 35,000 young women under the age of 35 die from cardiovascular disease in the United States. Myth number 2. Another myth is premenopausal women do not need to worry about heart disease. While it is true that an early menopause increases the risk of cardiovascular disease, it doesn't necessarily mean that a woman is immune. The relationship between early menopause and accelerated cardiovascular disease. Traditionally, we didn't see a lot of risk until after menopause. Today, we see the risk as continuous and increasing as we age. So it seems far more likely that cardiovascular risk is a lifelong process occurring in the background and which may influence and lead to an earlier menopause, which, when it happens, may feed back and further increase cardiovascular risk. Thinking back, you'll note that coronary heart disease progresses over decades and increases with time. The reality? Being premenopausal probably does not protect you from cardiovascular disease, and you should be vigilant at all ages. Myth number 3. Hormone replacement therapy is dangerous and should never be undertaken. To begin with, estrogen affects many parts of the woman's body, from the heart and liver to the uterus, ovaries, breasts, bones, vagina, and brain. The hormone fluctuates from being premenopausal to perimenopausal and actually changes during pregnancy as well. So it does impact the body. Estrogen is a cell growth stimulator. The amount of estrogen produced by the body changes dramatically after menopause. The two hormones that we look at that affect women are estrogen and progesterone. Perimenopausal symptoms with the change of these hormones are considered to be hot flashes, insomnia, and mood changes, while the menopausal physiology changes with vaginal mucosal thinning and osteoporosis. Now let's look at hormone replacement therapy. And the reason people think it is bad is because estrogen is a cell growth stimulator. So if you have cancer, it will actually stimulate the growth of the cancer tumor. But what is the probability of you actually having a cancer? The good part of replacement therapy is relief of menopausal symptoms, a reduction in bone thinning or osteoporosis, and we don't know, but we think it might have some cardioprotective effects. To study this, there was a women's health initiative, and they studied 16,608 postmenopausal women ages 50 to 79 who had an intact uterus. Some of this group of women were given estrogen and progesterone, while others were given a placebo. You can see with the hormonal replacement was associated with increased stroke, blood clots, heart disease, and cancer. Another comparison study using estrogen only was given to 10,739 postmenopausal women aged 50 to 79 who had previously had a hysterectomy. They were given either estrogen or a placebo. Due to the changes in hormone effect when you have a hysterectomy, this previous study was compared to the other study wherein women had an intact uterus. In the estrogen-only study, the conclusion was that in younger and postmenopausal women post-hysterectomy, estrogen alone may be beneficial. Estrogen can be administered orally or transdermally, and there is a difference. If we look at oral estrogen, it has a large impact on your liver metabolism. It can increase inflammatory markers, and it increases the protective HDL cholesterol. If we do transdermal estrogen, it bypasses the liver, so there's no change in inflammatory markers. It reduces your LDL. It also causes an improvement in atherogenic index of the plasma. So let's look at the reality. Estrogen therapy is reasonable for the relief of perimenopausal symptoms if started early and tapered after a few years. Estrogen administered transdermally may be less likely to increase risk of blood clots, and estrogen should not be given to reduce cardiovascular disease risk. Bottom line, probably safe when given to young women who are perimenopausal. Myth number 4. Vitamin supplementation is key to preventing cardiovascular disease in women. Vitamin supplements are marketed as heart healthy, but is that the truth? So let's take a look at a 10-year study of vitamin E in the primary prevention of cardiovascular disease and cancer. Again, patients were either given vitamin E or placebos. There were 39,876 healthy women, age 45 or greater, and the total was 636 of these women died who had been given vitamin E, and 615 died who were given a placebo. Pretty much the same. Here we'll take a look at a study on vitamin B and its effects on women for cardiovascular disease. This study took 7 years, and again, patients were either given folic acid, vitamin B6 or vitamin B12, or a placebo. And we come up again with 406 events for those that were given the vitamin B and 390 events for those that were given the placebo. Again, very close. The reality? Vitamin E and B vitamins are probably safe, but there is no convincing evidence that they need to be taken regularly or are a key to cardiovascular disease prevention in women. The entire supplement industry is unregulated. The safety and purity is entirely in the hands of the manufacturer. Many of these supplements may interact with medications, and some, such as ephedra, are downright dangerous. How about this myth? If I'm thin and exercise regularly, I should be immune to cardiovascular disease. Well, this is based on the reality that inactivity and obesity are just two of the many risk factors, but probably not the strongest. And exercise is great, but it's not necessarily enough to make you immune from cardiovascular disease. Myth number 6, eggs are unhealthy because of the cholesterol and should not be eaten. Well, eggs do contain cholesterol, and studies have shown a clear relationship between serum cholesterol and cardiovascular disease outcomes. But what the studies have not shown is a relationship between egg consumption and health outcomes. What is an egg? Well, let's take a look. The bad part of an egg, as you know, is the yolk, and this contains an average of about 213 milligrams of cholesterol, while the white contains 0. Our daily allowance for cholesterol is 300 milligrams. So, what is the risk? It should be okay to eat an egg if consistent with overall daily cholesterol limits. Here's myth number 7. Most women do not experience chest pain during a heart attack. Fatigue and shortness of breath are much more common. The facts: men and women present relatively similarly with heart attack for both genders. The important point is not to ignore the extra symptoms of a potentially life-threatening condition which women may feel. Heart disease is the number one killer of women. Chest discomfort is the most common symptom of a heart attack in both men and women. Women are more likely than men to have additional nonspecific symptoms, including fatigue, shortness of breath, and weakness. When we take a look at the comparison of men and women and the location of the chest pain, they are very, very similar, with the exception of jaw pain and neck pain is more prevalent in women. Well, we looked at the area where the pain occurs. How about the quality of the pain? Is it more intense? No, there's no difference statistically between the quality of chest pain for men and women. Myth number 8. Chocolate is sinfully bad and should be eaten only rarely. This could be true, but there is some preliminary data to suggest dark chocolate may be beneficial. What are the benefits of dark chocolate? Well, it raises protective HDL, it improves insulin sensitivity, it lowers blood pressure, and it improves endothelial function. I guess you could argue some of that would be clinically relevant. So we should ask our doctor for a prescription for dark chocolate. Let's see, it could look like this. Dark chocolate, 100 grams, directions, 1 bar daily, and dispense a 30-day supply. Now, try to get your insurance company to reimburse you for that prescription. And finally, we tackle myth number 9. Exercise is beneficial only if prolonged. No pain, no gain. The facts. There is a dose-response relationship. More exercise is better. Strenuous exercise is probably better than less strenuous exercise. And several studies have shown that the repeated intermittent periods of exercise have a cumulative effect similar to prolonged exercise. So we can finish up by saying average lifetime risk for cardiovascular disease in women is very high, about 50%. Women need to be aware that they are at risk. Prevention can make a big difference both in individuals and in different populations. So lifestyle measures are the foundation of prevention. Now let's stress the 3 take-home points from this presentation. First, much of cardiovascular disease is preventable. Second, much of cardiovascular disease is preventable. And third, much of cardiovascular disease is preventable. So thanks for your attention and time, and I hope some of this information was helpful for you.